Good afternoon.
Good afternoon, y'all. What's going on?
Hey everyone,
Tell your problem. Oh, is she?
Hey everyone, it's Alex at WildTech. We had a technical issue with our other meeting room, and so we're trying to move folks into this session and get going shortly. I'm sorry for the delay, but we're getting folks set up.
I mean, you long delay, shoot.
That's all right.
I'm really sorry about that. We're still troubleshooting it, but we should be able to get started soon.
Okay. Well, in the meantime, we can chit chat.
Thank you.
Thank you, Alex.
Good morning.
You're welcome.
No, good afternoon, ladies.
No, it's good afternoon. But you know, Miss Diane, how you doing, Miss Diane? Miss Leach?
This Miss Jared.
Hi, Miss Jared. How you doing?
Fine.
Good.
Waiting on my book, but I'm doing fine.
What book you waiting on?
The Eat and Heal health book.
Okay. I'm waiting on. I'm gonna get that book that you told me about. I'm sorry. I'm gonna get it from Amazon.
Get it for what? No, get it from Walmart for $4.98.
Okay. Let me write it down.
That's what I'm waiting on. Mine. I just paid $4.98 for it. Hardback. Mm-hmm.
Okay. And you did it online, Miss Jared?
Yeah, I went online. I went on Walmart line and I did it. Eat and Heal. I claim it be here tomorrow.
Okay, Miss Jared, do I need to have a Walmart account? Because I don't have one.
No, but you'll start one. But okay, you go on Amazon and get it.
Okay.
I look for it being used here.
Okay.
Because I think that new book is what, $15. I think that's too much for it, because that's an old edition.
Right. Okay.
That's one of the original books that was printed out when they was doing, food that heals your body.
What's the name of it again?
Yeah, the lady, one of the doctors of Howard University helped write that book.
What's the name of it?
Eat and Heal.
Eat. Let's say it again, Miss Jared. Eat.
Wait a minute. I know I'm saying it right. Wait a minute. Where's my paper? I got the
Eat and Heal.
Eat and Heal.
Okay. All right. That's the book.
Hi, everybody.
Hi, everybody.
That's Aunt Dennis. I was on the other number that they sent on the thing, and I was waiting. I thought they weren't going to start the meeting.
Me too.
Me too.
Yeah.
I'm just getting on about 1:18. I only been for 2 minutes.
Oh, okay. So he
and I started 12:40.
He had
12:40. I called everybody.
Okay,
hey everyone. Sorry, we're working through the delay. There was an issue with the other meeting room.
Miss Jared, I'm gonna send my phone number to you.
So we can go home, huh?
Normally when they take too long, I'll call the help desk.
We did. I got the help desk and I got the left message because they wasn't answering the phone. I called my tech that I was supposed to have special for me, Miss
I did too. But it's okay now.
Yeah,
it's all right.
As soon as I called just now, they answered.
Okay.
They just started. That's
Can you be quiet for a moment?
Oh.
The vendor who's supposed to be on board right now has failed to do their job. So I am getting the speaker to switch to this meeting, and I'm working on it. So please be patient. Okay.
All right.
Teresa, Lou just emailed that Joe is opening up the other meeting room.
Well, I just told Alice to have the speaker go on this one.
Okay.
I just told Alice to do that. It's not fair to the seniors to be switching back and forth. So I just told Alice to do that.
6154. Okay.
So I'm waiting now to see if she will have him. He should show any moment now. Can you please turn your TVs off?
Hey, Teresa, I'll mute everyone.
Or you mute your device. Thank you.
Hey, this is Alice. I'm logged on there. I'm trying to get Chris to join it.
Thanks, Alice. And Teresa, I just muted everyone, but just gave you, I asked you to unmute.
Okay.
Okay, Alice.
That's Chris. Okay.
Did you get Chris on board? There you go. I can see him now.
Okay, wait, hold on. Chris, are you on?
Yes, he's here. He's
Okay.
on board.
Sorry, I was just
Yeah,
muted.
I thought that was him. Okay.
So Chris, you're just going to have a conversation, right? No slides.
Yes, yeah. I think
Okay.
let's do the same thing.
Okay, yes, I guess you'll begin. You can go ahead and take the mic.
Okay. I think Allison asked me to join just to go over a few things. I work with the DC Department of Aging. I work with the state health insurance program. So the SHIP office, we provide, anybody can call the SHIP office. We have a hotline where you can call if you have questions about Medicare coverage or Medicaid coverage. And we also help people to apply for benefits, help resolve any problems, help people access more affordable prescription drug coverage. The two particular programs I think I was going to briefly cover. One is the program through the Department of Healthcare Finance. It's called the Qualified Medicare Beneficiary Program. So basically, any district resident who's eligible for Medicare coverage, if their income is below $3,418 a month for an individual, I think for a married couple, it's close to $4,600 a month. You would be eligible for assistance with paying Medicare premiums, qualifying for free prescription drug coverage. There's no asset limit or savings limit to the QMB program. It's very easy to apply for. We can send some follow-up information after this. If you have any questions about the income limits or eligibility, and I'll make sure and put our hotline number in the chat at some point during this call. Qualified Medicare Beneficiary Program, for those who apply for it and are eligible, pays for your Medicare Part B premiums. So it saves you $170 each month. Money goes back into your Social Security benefit. It qualifies you for a free Medicare drug benefit with really low copays for medications. I think the other program I wanted to cover is called the Elderly Persons with Disabilities Waiver Program. So it's a home and community-based waiver. It's a day Medicaid program that's designed for people who meet nursing home level of care. So they need assistance with activities of daily living. The EPD waiver program can provide personal care aid, a certain number of hours for over personal care aid, and also provides other benefits meant to help people remain in the home. There's a process to applying for the EPD waiver, but there is a team at the DC Department of Aging that help people walk through that process, help complete the applications, and move someone along until they're eligible, until they're connected with the benefits of the program. And the home and community-based waiver generally starts with getting an assessment. Your doctor fills out a short form. And then Liberty Healthcare calls and conducts an assessment over the phone. To qualify for the EPD waiver, individual's income has to be below $2,523 a month. It's a little over $2,500 a month. And for this program, there is an asset limit, a savings limit of around $4,000 for an individual. These are good programs, certainly for those who are eligible for them. And they can definitely provide monetary savings or help people access lower cost healthcare and prescriptions with the EPD waiver. It can prevent people from going into a long-term care setting when they're able to remain in the community, living in their house or apartment with some limited assistance. Let's see. Let's put the SHIP hotline number in the chat. So again, the SHIP hotline is the state health insurance program. It's the office that provides answers to questions about, Medicare coverage. Right now it's Medicare open season. So if you have Medicare between October 15th and December 7th of every year is a time where you can switch from one Medicare drug plan to a different one to see if you can access lower cost prescriptions, save money, or switch to a Medicare Advantage plan, or even from one Medicare Advantage plan to another plan. So again, that window is from October 15th and it ends on December 7th. It's a busy time of year for us, but we can answer questions, anything related to Medicare or DC Medicaid. And we certainly help residents, advocate for residents who are having questions or are having problems with either of those benefits. Anybody has any questions, I can field them at any time.
Let me see what hands are raised. I've got one hand raised. Teresa Durbin, go ahead and unmute.
Yes, I have a couple of questions. Good afternoon, everybody. One question is, how long must you live in DC before you can apply for Medicaid, especially the part with the EPD waiver? Could you hear me? Oh God, I guess not. Oh crap, what is the problem?
Well, we're hearing you. We're hearing you, Teresa.
Oh, okay, good.
I'm hearing you.
How long must one live in DC? I asked because I have an aunt that lives in Maryland and wants to move to DC where her relatives are, but she's scared to move because she has Medicaid in Maryland. And I said, you shouldn't be afraid of that because they have Medicaid everywhere. So my question is, how long must she live in DC in order to apply for DC Medicaid, in particularly the waiver portion?
Did you hear that, Dennis? You're unmuted. Let me see if we can unmute you. Hold on. Chris. I think he's muted. So hold on, let me see if I can get him unmuted. We had to mute everyone because of the, so let me see, CHRI. Give him, ask him to, I'm gonna ask him to unmute himself, which I just did. Chris, can you unmute yourself? Chris, are you hearing me? Go ahead. Yeah. Okay. Go ahead.
I can't. Oh, here now I'm unmuted. So I wasn't able to unmute myself. So okay, the question. So states are different as far as how long you have to be a resident before you can apply for Medicaid. Some states there's a 3-month wait. In the district, you really literally have to be across the line and present in the district to have a residence. So there's no waiting period to apply for Medicaid coverage in DC. I would say this, every state has jurisdictions, districts have a Medicaid program. How those programs look and work, very different state by state. And the district does have some of the highest eligibility limits for some of its Medicaid programs. But again, in answer to your question, you really just, somebody just has to be present and intending to remain in the district to apply for coverage.
Apply for coverage. And once they apply for, well, my aunt that I'm particularly calling about, her monthly income is $1,800 a month. And I told her, I believe that's over the income for Medicaid. But maybe she could check into Medicaid waiver because that's how I have Medicaid, through Medicaid waiver. So once she moves into DC, she should apply for DC Medicaid. And at that time, you know, she'd go to, I guess, DC Office on Aging to apply for waiver because they will automatically tell her she's over income for Medicaid.
Yeah, Medicaid in DC for people with Medicare, the full Medicaid is the limit. It's around $1,153 a month, so $1,153 a month. the difference between that and the EPD waiver is EPD waiver income is higher, so it's over $2,500 a month. But to qualify for EPD waiver, you also have an assessment. And there's a certain score of 9 on the assessment.
Yeah, I'm familiar with that part.
Yeah, and so
because I had to go through that part.
Okay, yeah, so she's definitely eligible for the QMB program in DC, but that wouldn't help with personal aid assistance. But yeah, she would definitely qualify, at least income-wise, for EPD waiver. So it would just be a matter of getting a DC Medicaid physician to complete that prescription order form.
I see. And I just have one other question.
Before you go any further, I'm trying to limit everybody's questions to 3 minutes.
I got you.
Because it tends to go overboard and others are waiting. You can always come back, but limit your questions to 3 minutes. That's it. Okay? All right, so our next question is coming from Doris Foreman. Can you please limit your question to 3 minutes and no more? Doris, unmute.
Yeah, can you hear me?
Yes, please limit your questions to 3 minutes and no more.
Not a problem. I'm just wondering what this flex card thing is that I keep getting people calling me for on my phones and you know, emailing me about the flex card program. How does that fit into anything? Is there any validity to getting that? Or is it just another scam?
I'm not familiar with the flex card. I could definitely find out about that. I'm not, at this time of year in particular, you're getting bombarded by television advertisements, brokers at the pharmacy, mail, and I always tend to side on the of caution and assuming things are fraudulent. We can certainly find out, and we can circle back and get information to this group.
Okay.
But I'll talk with some of my supervisors to see if they're familiar with it.
All right. Thank you.
Sure.
Okay, and the next person, Ann Dennis, I'm asking you again to limit your question no longer than 3 minutes. Thank you. Go ahead, Ann.
Okay, I couldn't get unmuted there. I was interested, Chris, in your number again. And I also was asking about the United Healthcare. Are they taking over the Medicaid, your Medicaid program? And if so, I'm not too happy because I enrolled with them and then I unenrolled myself because I had somebody trying to tell me I had to have a limited amount of aids in at a limited time. And I told them I had 12 hours a day, and I don't know what you think I'm gonna be doing.
So the Department of Healthcare Finance, which is DC Medicaid, has made an agreement with United Healthcare. So United Healthcare is providing for people who choose to enroll in United Healthcare. United Healthcare provides both their Medicare and their DC Medicaid benefits.
Okay.
For anyone who has Medicare, you have a choice of how you want to receive your Medicare and your Medicaid. So enrolling into that Medicare Advantage plan is an option and will always remain an option. You can remain in fee-for-service Medicare. You have Medicare and a Medicaid card. Go to any Medicaid provider you want to with a standalone prescription drug plan. So they are trying to kind of move people into that United Healthcare, but it is a choice. And please always remember that.
Thank you. I appreciate it. I was confused because I was told that you had to join that to get Medicaid in the district, and I was not under that impression when I talked to them. So thank you for clearing that up, and have a good day. And you're very interesting and very informative, and thank you very much.
No, anytime. It's the Department of Healthcare Finance recently mailed out a letter to all people with Medicare and Medicaid, 45,000 people, talking about United Healthcare Dual Complete and the PACE program. And it's fine for them to send out that information, but it's also important to make sure everyone knows they have a choice. And you can enroll in one of those plans throughout the year, and you can disenroll from one of those plans throughout the year as well.
Hello. Okay, thank you. Our next question is coming from Priscilla Cornelius. Please limit your question 3 minutes.
Is there closed caption available?
Not at this time. I'm sorry.
Thank you.
Please go ahead and ask your question.
What was my question?
You have a question?
Are you still dealing with Priscilla Cornelius?
Yes, you have. You asked your question.
Yeah, that was, I wanted to, I need sometimes CC.
Oh, okay. All right. I'll move on to the next person. Next person will be Janice Sanker. Go ahead and unmute and ask your question.
My question is, what is the difference between a United Healthcare Advantage versus just having regular United Healthcare when you have Medicaid? And what is, and can a person still have services my way with having United Healthcare Advantage? I was told there was a difference between United Care Advantage and regular United Healthcare. So could you please explain that? Thank you. Did the young man go away?
Oh, I don't know what, he's speaking, but he's muted again. So let me ask him to unmute. Go ahead, Chris. I don't know what's happening, but
we never
you're
heard
still
you.
muted. He heard you, but he's just, go ahead, Chris. I don't.
Okay, they took it up there. I don't know what happened. I got muted again. So if you enroll in United Healthcare, dual complete, they now have a contract with Medicare. They have a contract with DC Medicaid. So they're responsible for providing all of your Medicaid coverage. That includes your dental benefits, your vision coverage, your EPD waiver services. So if you're enrolled in EPD waiver and you enroll in United Healthcare, you have to use a case manager in their network, but they are supposed to be providing services my way as well. Any benefit you're eligible to get through regular DC Medicaid, you should be able to access through United Healthcare. The only difference is the different provider network. So if I have just Medicaid, I have a Medicaid card, I want to go find a dentist, I just go see a dentist who takes DC Medicaid. If I'm in United Healthcare's network, or if I'm enrolled in United Healthcare, I have to go see a dentist who accepts United Healthcare. So the main difference between the two programs is this provider network. So again, you would be eligible to get services my way. United Healthcare has to provide your EPD waiver benefits, home health aides, case management, and services my way.
And why is every home healthcare agency asking, I'm saying that they don't have no help and they can't give nobody an aid? If you got EDP waiver for 24 hours, why is that a big thing going on? And I see the people working, but they're trying to say that we don't have enough people to come out and give me the services. I don't understand.
It's been an ongoing issue. Definitely, it's gotten much worse since the whole 2020 when the public health emergency started. We raise this question with healthcare finance all the time. DC Medicaid. I know they're trying to work on incentives to get more people hired, but can't entirely answer that question. I know it's been an ongoing problem, certainly for the last several years, 2-3 years. I know there are a lot of people trying to fix it over at healthcare finance, but I still know it's an ongoing issue. For people sometimes if they're only getting 6 or 7 hours, are having difficulty getting those filled. There can be challenges. and it's difficult to, there's a bunch of different agencies, but we've recommended to healthcare finance that they find ways of, at least, if they know of agencies that have staff that can accept clients, that they let us know, or so we can let people know. But I'll certainly raise it again with healthcare finance, but I know they're working on it. But at this point, it's an unfortunate problem.
Okay. The next person we're going to get a question from is Gloria Johnson. Go ahead, Gloria. I've asked you to unmute. Can you please unmute and speak? Gloria Johnson, unmute. All right. I'll go to Glenda Coleman. Go ahead, Glenda, unmute and ask your question.
Good morning. This is Janola.
Go ahead.
Yes. Today I was in here and this gentleman called me and asked me that DC Medicare was sending out new cards and he wanted my number and I wouldn't give it to him. Are they doing that? So
No. Anytime anybody calls you for asking you for any numbers, like Medicare number, Medicaid number, just assume it's a scam. If they're going to come out with a new card, they're just going to mail it to you. They know who you are. They know what your Medicare coverage is. Or DC Medicaid is sending out a new card. They know who you are, where you live, what your ID number is, everything. They would just send you a new card. It is awful. It's year round, but it's really worse this time of year because so many scams. No one from Medicare, Social Security, or DC Medicaid, whatever, call you unsolicited, call to you asking for that information.
Yeah, because I hung up the phone and he called me back and wanted to know why did I hang. I said, because I got to make sure that don't sound right, and I hung up on him.
No, in our ship office, we won't cold call you. We'll call you back to respond to your call if you leave a voice message, or there's a way you can leave a request to call back, but we won't unsolicited call you. And I'm glad you did that. And please always remember, okay. No one will ever call and make that request. At least a legitimate person. Yeah.
Okay.
Okay, our next question is coming from Gloria Johnson. Go ahead, Gloria.
Yes. Okay, I have United Healthcare Dual Complete. Now, my concern is, like they say, is open enrollment. And I've received a letter from United Healthcare saying if I'm going to stay in the United Healthcare Dual Complete, do I have to sign up or do anything?
No, with Medicare enrollments, whether it's a prescription drug plan or Medicare Advantage, if you don't do anything, if you don't change anything, it's just going to roll over in January 1st. So on January 1st, it'll still be in place. So it's same with a Medicare drug plan. If you don't pick a different plan or Medicare Advantage, it'll just stay the same.
Okay.
Yeah,
thank you.
You don't have to make a change.
Mm-hmm. Our next person is Pauline Harris. Go ahead, Pauline.
Hi, everyone. I just wanted to know if United is a HMO.
So currently, United Healthcare Dual Complete, there's some modifications to it next year. Currently, it's a preferred provider organization, so PPO.
Okay.
Next year.
And that's a part of my question, because one day they asked about, where can you use the United card at? Because my doctor won't accept it. I go to GW and I asked him before I got it, I said, let me make sure that my doctors, because all my doctors are GW, and they wouldn't accept it because of HMO or PPO. And I don't know what those letters meant. So I have to be with your doctors in order to be with them?
So United Healthcare is a Medicare Advantage plan. So they have their own network of providers. And when you enroll in a Medicare Advantage plan, you're kind of tied to that plan's networks and providers who accept that insurance. Currently, United Healthcare is a preferred provider organization. So it just means that I don't have to go to a primary care doctor who then refers me to a specialist. I can just go see the specialist if I want to, but it has to be in United Healthcare's network. And HMO is health maintenance organization. Kaiser is kind of one of the more well-known HMOs. Those work a little different. So I have a primary care doctor. So, you know, I think I need my heart to get checked out. I can't just go to a cardiologist. I have to go see my primary care doctor. My primary care doctor then refer me to a cardiologist. And so anytime I want to do that, that's how that works.
So you private, you PPO.
Well, I mean, I don't work for United Healthcare.
United is private, right?
So they're a PPO currently. They're preferred provider organization. So they're a Medicare Advantage. So when you enroll in that plan, you turn your Medicare and your Medicaid coverage over to United Healthcare. You have to use providers in their network.
Well, so I think I'm going to stay with Medicare and Medicaid. It don't make no sense to jump ship if, you know, if something is working for you.
Yeah,
you know, so.
There are some advantages to United Healthcare. I mean, they give some stipend for over-the-counter products, but I mean, if your doctors are don't take it. I mean, there was an issue for a while. GW stopped taking United Healthcare. I don't know if it had changed at all. And some people were just, you know, their oncologists was at GW, all their doctors were at GW, and they disenrolled because their insurance didn't work there. And that's something you can do anytime during the year.
Okay. Thank you.
Sure.
Thank you. All right, Pauline. Our next question is coming from Ann Dennis. Go ahead and unmute. Unmute. Ann Dennis, you have a question? You need to unmute.
Okay, can you hear me now?
Yes.
Okay, sorry. That was one of the things that you answered part of it about the shortage of aides. I have the waiver and they're struggling to get people. I've gotten some more hours and it's rough because the girl that went with me, she's got another case, and so we're kind of splitting things around and doing so many hours here and then going back and doing so many hours there and coming back, and so it's been rather confusing. So I have talked to a couple of people, and they just seem to a couple of people just seem not to want to be working anymore since the pandemic.
You know, I mean, I'll certainly take all of this back to, I mean, we have regular meetings with DC Medicaid, with Healthcare Finance, and the ones who oversee this program. I know they're aware of the problem. Taking steps, you know, we hear it a lot. And we do know, I mean, some people have 2 different agencies and they're splitting hours between. But I appreciate you letting us know those concerns. I'll certainly take it to the people who can influence this. You know, something, if there's a big, you know, you certainly let your case manager know, reach out to the Department of Aging if there's a serious situation. Like if you're 8 hours short of something or 6 hours short, or your aide just doesn't routinely come up, call the Department of Aging, at least let us know there's a problem. And we can take that to Healthcare Finance, because I can reach out to the people who run this program and, you know, they can take action. And they don't unless they actually hear about it. But they're, so again, feel free to call the Department of Aging with those concerns.
Thank you. I appreciate it. And would you put your number back in the
chat again? It's already in the chat, Ann.
Yes,
all right, thank you.
I'll put it in again. My email as well. So feel free to email me anytime or call.
Right. So we've got about 9 minutes left. So if you have any questions, this is your chance. 9 minutes left. Anyone? Questions? Concerns? You'd like to share? I have a question from Teresa Durbin on the chat. It says, why is Medicaid refusing to pay lidocaine 5% CREA? Why are they refusing to pay that? Lidocaine 5%.
So
cream.
That's a Medicare prescription, covered by Medicare prescription drug coverage. It can vary. It depends on how you get your Medicare prescription coverage, whether it's through a Medicare Advantage plan or a Medicare Part D drug benefit. It could just be it's not on a formulary for your prescription or your Part D plan, but it is something that you can call us with. And I can look up because I know that it's covered. But some plans have certain medications on their formulary and others don't. If it's not on the plan's formulary or preferred medication, there's a ways to appeal that if your doctor helps with that. But it could just be that it's not covered by your particular drug benefit. And again, if you get your prescriptions through Medicare Part D, there are about 25 different Medicare Part D plans, all with different formularies and things. And we can get a list of your medications. We can look to see if there are alternative plans that might cover everything you take, and even for less money than what you're currently paying. Always the case, but sometimes it is. And again, you can make that switch fairly easily to switch from one drug plan to another.
Okay, thank you. We've got another question coming from Janice Sanker. Go ahead, Janice, unmute and ask your question. Go ahead, Janice, unmute.
There you go. Why can't my mother has United Healthcare Advantage, dual, whatever that mess is, and Medicaid, Medicare. She's 87, be 88 in 2 more months. And why can't she get transportation from the nursing home to her doctor appointments at GW or George Washington or at Washington Hospital Center? Medicaid won't provide transportation no more. We tried to set transportation up with United Healthcare, and they lied and said they called or they showed up, and we stood out in the cold for an hour waiting on them, and they never came at the nursing home on September the 27th. And the case manager is just running circles. And I am tired. I am tired of this mess. You know what I'm saying? So what is the solution that you can give me? Because my mother needs to go to an appointment on November the 10th. And so what is the solution? What is the solution? I keep calling and I'm getting run around in circles and circle after circle after circle with no answers. I am at the point where as though I am thinking about taking her out against medical advice, and us as families members take care of her at home, because she's not getting any kind of services, physical therapy, occupational therapy. She's getting bed sores, and I'm sick and tired of it because they're not cleaning between her fingers, nothing. You know what I'm saying? So these homes.
Janice, can you ask your question and let's limit the...
I just did it.
Okay, go ahead. So give him a chance to answer.
Okay. I never questioned it. As far as the transportation, I may have to more details to figure out why they're responsible for providing her Medicaid transportation. If she's enrolled in United Healthcare, just like MTM does if you have regular state plan Medicaid. So if she's in a nursing home, EPD waiver is something that you consider, at least if you're considering bringing her out of the nursing home back home. We actually have a team of people at the Department of Aging, this community transition team, that will help people who are currently in a nursing home setting to transition out back home with EPD waiver coverage. So they make sure everything's set up, hospital bed in the home, adaptive equipment in the home. They make sure that's set up.
She got all of that.
But they can, she obviously needs nursing home level of care if she's in a nursing home. Or has she been there for a while, or?
Yes, and it's supposed to be for physical therapy, occupational therapy, and speech therapy only, not to live there forever.
But she's been there for an extended period?
She's been there since December of last year, and they have not provided the services.
I think the community transition team, might be a good way of helping her kind of.
She has the EPD waiver 24 hours, and it's nothing being done.
She has EPD waiver, or?
Yes, she does. She's been granted already. It's been over 6 months. She's been granted.
But she's still in the facility?
Yep.
Well, I think this may be a better situation.
I need help.
To discuss one-on-one.
Yes, thank you.
So call us, call the number, the ship number, and ask for Chris. And they'll get you connected to me, and then we can have a conversation. There's probably more details I need to look up.
Okay.
And we can have a one-on-one conversation about
Thank
that.
you.
Okay? Sure.
Thank you, Miss Teresa.
Any other questions? Certainly, if I didn't get to your question today, I'm not sure. Who's still here? If I didn't get your question, you certainly can email me. My email's in that chat, phone number's in that chat as well. We're here Monday through Friday. We'll respond to calls as quickly as possible. I'll put the phone number in again.
Chris?
Yes.
This is Ann Dennis again, and I'm sorry I waited. Nobody answered you, but I wanted to thank you very much for answering that question, because I have a person who's getting into.
I think you got muted. Are you able to unmute yourself?
Hello?
I can hear you now.
Yeah, okay. I'm having a person that I'm trying to help. He's going blind, and he's having some type of mental thing, and he has a waiver, and that they're looking into giving him the 24-hour waiver. He has 12 hours because he's going to need some help because he's going blind and he's gotten crippled. And so you answered a lot of questions. Thank you so much for offering your hand out and help, because sometimes we don't get all these answers and you get the runaround.
I know. I mean, we can, unfortunately, don't have a lot of control over some of these programs. We help people access them, but we do have, we communicate with those people who may not meet with people in the community as much to hear the problems with the programs, and aid's not showing up, and not filling the hours that they need. But we can definitely. I can mute it again. So again, it's helpful to hear this, because again, we can advocate for you by taking this information and going to healthcare finance and letting them know the problems with the programs, making sure they understand your experiences, and we absolutely do, and we absolutely will continue to do that. We appreciate hearing from everybody and hearing your stories. And these aren't perfect programs, but they should be working better than they are.
Okay, Mr. DeYoung, I'd like to thank you once more. I'd like the seniors to show their appreciation by waving or saying thank you. And hopefully we'll see you sometime again.
Thank you. All right. Thank you again.
Bye-bye.
Thanks
very much for the service.
Thanks.
Thank you so much.
Thank you.
Thank you, Christopher.
Have a good day.
All right.
Put your number in the chat, please.
For the rest of you, just want to thank you again. I don't know what happened to Vex Group. I'm just really apologizing for what happened. And hopefully it's not repeated again. Have a wonderful afternoon and see you tomorrow.
This is technology, Miss Teresa.
See you tomorrow.
What is the number?
Goodbye.
If anybody number, please put it in the chat.
It's in the chat. It's been in the chat. It's been in the chat. If you need
if anybody got it, just put it in the chat, please. Thank you.
It's not
I
in the
can take
chat.
a picture of it.
All right. Teresa, it's not in the chat because it's gone.
Okay, I'll read the number off. It's 202. Be ready to write it. 202 727
yes
8370. Again, I'm going to read it.
Thank you.
202
Wait a minute.
8370. And I'm going to say goodbye at this point. Thank you for your undivided.
Thank you too.
Bye-bye.
Bye.